Hello, viewers. Welcome, everyone. Now, Dr. Gianfranco will give us a story of a fascinating journey how BioGaia, a probiotic, quite innovative and research-oriented company in Sweden, has made its journey in last 30 years. So, Dr. Gianfranco.
Thank you very much. Thank you very much for giving me the opportunity to present what we're doing at the Research and Development Department of BioGaia. My name is Gianfranco Grompone, and I'm the CSO of BioGaia. And we're gonna discuss about translational approaches and research and development at BioGaia is a fascinating translational journey. And this journey starts with bacteria, starts with microorganisms. So let me first start my presentation by presenting the Holobiont concept. And a very important concept for BioGaia is the hologenome theory of evolution. As you know, this has been published recently in the 2008. It was the first publication where this hologenome theory of evolution was coined or presented. And the main idea behind that is that the human beings and the human species are not only humans, but mainly human and microbes symbiosis or human and microbes ecosystems. So when we talk about the human species, we are talking about the genome, the human functions, the human organs and cells, as well as the microorganisms. And these microorganisms, mainly bacteria, fungi, viruses, but also some parasites, are coexisting and co-evolving with the human physiology. And we need to consider that because the whole co-evolution concept is a concept where the whole shaping of the interactions and crosstalks between human bodies and their environment has been created by evolution and probably the last thousands of years of evolution. So this is a concept which is very important and is at the heart of what we're doing in BioGaia. So as you know, all our mucosal sites are colonized by microorganisms. I'm going to focus on bacteria. And these different mucosal sites, meaning the gut, of course, the oral cavity, the skin, the vagina, the lungs, etc., are not colonized when we are born. So after birth, the first colonization is extremely important. So what I presented here is what we call the perinatal period, which is a crucial period for gut microbiota establishment and immune maturation. And this is also crucial for the following of my presentation and the rest of the presentation, because what we're talking here is we're talking about molecular training, which is induced by this microbiota, especially the intestinal microbiota, towards our immune system. So the immune system is not knowing basically nothing, and when it encounters the diverse ligands which are present in the microbiota, and especially the bacterial ligands, these ligands are inducing anti-inflammatory responses, specific physiological inflammatory responses, and especially maturation of some immune cells, which is crucial for the development. So what I'm showing here, taken from a publication from Diego Peroni, a recent publication, is a very interesting review. We have in this perinatal period a window of microbiome modulation and microbiome establishment. And there are some factors in the perinatal period, either the prenatal, so the gestational aspects are important. We are extremely interested in inducing probiotics for gestation in BioGaia. We are also interested in afterbirth, what's going on with the establishment of this microbiota and how probiotics could help this microbiome induction, especially given the type of birth is extremely important. A vaginal delivery is inducing primocolonizers in the baby's microbiota, which are completely different if these babies are born by C-section, and this has been established in the recent years. So bringing probiotics, bringing microorganisms which have been co-evolved with human beings for thousands of years, like the ones we are working with, is bringing educational training for the immune system from the very beginning of our life. And then the postnatal period until 2 to 3 years is also extremely important, where the type of feeding, some of the lifestyles, the fact that we are using antibiotics or not, etc., all these factors are also shaping the diversity, the structure, and the composition of the gut microbiota of the babies. So we are really interested on this mother and child concept, but especially through a kind of microbial eye in BioGaia. So the reason why I'm mentioning that also is because in the recent years, and this is a publication by Martin Blaser that was published in 2017, it was associated with a wonderful book called Missing Microbes. And the main concept here is that our lifestyle, our modern lifestyle, is attacking in a chronic manner the diversity of the microbiota. And this diversity is affected. And what we do know today is that one of the common features of all the, I would say, chronic diseases and the real pandemic diseases that we are suffering today, meaning metabolic diseases, metabolic syndrome, inflammatory diseases, non-communicable diseases, neurological diseases that we were mentioning before. All these diseases were associated with a lack of diversity, with a lack of some of these members of the microbiota, and that could be represented here in this chart, where we see that the vertical transmission from the mother to the child, especially because most of the births in some countries are given by C-section instead of vaginal delivery, but also the horizontal transmission has been affected by our lifestyle. So the consequences of that is a chronic loss of members of the microbiota. So the idea that we develop in BioGaia is this concept of bringing back some of these invisible heroes that we can call, bringing back some of these bacteria that are missing, and then we can bring back immune training, we can bring back bacterial ligands, which are bringing modulation of the immune system, etc., etc. So we are talking about, in BioGaia, we are really interested on these specific probiotic strains. They are called Lactobacillus reuteri. So today we call them Limosilactobacillus reuteri because from the taxonomic perspective, there were some recent changes. The Lactobacillus genera is a very complex genera with more than 25 different genera within this genus. So this is why today Lactobacillus reuteri is called Limosilactobacillus reuteri, but this is just a taxonomic detail. But the main point that I want to address here is the fact that when we talk about this coevolution, when we talk about bringing back these members that were lost in our microbiome through the recent years, we are talking about bringing back bacteria that understand how to develop mutualistic relationships with our immune system. And this is an example from a paper that is now a quite old paper, which is mentioning the concept of the paradigm of coevolution between Limosilactobacillus reuteri and the mammal physiology, and especially the intestinal homeostasis of mammals. Not only humans, but also that has been shown in other type of mammals. And what you have here is an example of how these probiotics is inducing a reduction of inflammatory signaling, meaning TNF-alpha, IL-12, etc. And the consequences of that are physiological consequences. So we are, and this is why we are talking about the translational journey, we are starting from the clinical perspective, understanding what's going on at the clinical level, going back at the basic science and understanding these crosstalks, why some of these Limosilactobacillus reuteri is inducing Tregs, and these Tregs are inducing IL-10 or are reducing inflammation by secreting TGF-beta, and then going back to the clinicals to understand that these mechanisms are applied in specific conditions or in specific indications. So the mechanistic insights that we have on these mutualistic relationships, on this symbiosis, on this human microbes symbiosis, are at the heart of what we're doing in the research and development department here in BioGaia. So a last comment that I'd like to say is, as you could see in the picture, just here, this Limosilactobacillus contains specific microvesicles which are present at the surface of these bacteria. So we are now developing a PhD program where we have a student working specifically on what are these microvesicles, what are they doing, what is the content of these microvesicles, and are these microvesicles potential messengers for the immune system? Are there potential messengers bringing specific informations in the host? And these are the type of questions that we are addressing right now in the Uppsala University. So, Limosilactobacillus reuteri, I'm going to show you some pictures because this is a beautiful bacterium that you can see here. So these are images from microscopy, so scanning microscopy, electronic microscopy. So you could see that these are typically lactobacilli. And the story of the Limosilactobacillus reuteri is also a fascinating one. The strain we're working on is a strain which is a real representative of this microbiological bond between the mother and the child. The reuteri or the reuteri species have been identified in the 60s by Professor Reuter. It was called firstly fermentum. It was not identified as reuteri in the 60s with this name, but it was reclassified in the 80s as Lactobacillus reuteri. And further study by Dr. Candler. And the reason why this further characterization was changed is because the secretion of a specific bacteriocin was identified, the reuterine, and this reuterine is an extremely important probiotic feature of this Limosilactobacillus reuteri because it's a bacteriocin able to inhibit specific pathogens, gram-negative pathogenic bacteria, gram-positive pathogenic bacteria, but also other pathogens like fungi and even parasites. And I will come back to that later on with some data that we have. What is interesting is the strain we're working on, Limosilactobacillus reuteri, was isolated by Dr. Casas, Ivan Casas, the first research director of BioGaia, in the late 80s, and in 1990, it was identified from a sample of breast milk in the Altiplano in Peru, from a mother of Peru in the Altiplano in Los Andes. And it's interesting to see that the origin, the human origin of this strain is extremely important. It is coming from breast milk, so it's already there in the connection between the mother and the child. And from this strain, we did some curing of a couple of plasmids that were present in the natural state. And we cured this strain from this plasmid that were containing some antibiotic resistant genes. So this strain is not only perfectly natural, but also perfectly safe. So what are our focus areas? So as we were mentioning at the beginning, this is a translational journey. So what is extremely important for us is the clinical efficacy of our probiotic strains. We have more than 224 clinical studies. We are right now performing quite important amount of these clinical studies. These are the clinical studies which are already finished, more than 200. more than 18,000 subjects were involved in these clinical studies. And what is extremely important is when we mention these clinical studies, we are mentioning randomized placebo-controlled trials. And we really put a lot of efforts and a lot of importance in this randomization and placebo-controlled trials, and also on the independency of each trial in comparison to the others, because and this could be seen in other publications where we see that the meta-analyses are showing that Limosilactobacillus reuteri is among one of the top 3 probiotic strains studied in the world. So I'm gonna mention 2 main areas for this presentation: the mother and child area and the healthy aging. I will also talk about the oral health. So what we have here is just a representation on this perinatal period that I was mentioning before, and how the BioGaia products and probiotic strains are recommended for these different areas: pregnancy, birth, infancy, and childhood. I'm not going to go too much into details for the products, but it's important for you to know that this Limosilactobacillus reuteri and sometimes this strain, the DSM17938, but also other strains like the PTA 5289 are combined in these products. So I was mentioning the clinical trials. I mentioned specifically more than 18,000 individuals. If we consider only Limosilactobacillus reuteri DSM17938, because the 18,000 individuals involved in these clinical trials are considered for all the probiotic strains that we have. But if we consider only this strain, we are talking about different ages of subjects in these clinical trials. And the first concept, which is important for the clinical trials and for us, is the safety. I mentioned already before that Limosilactobacillus reuteri protectis is considered safe. It fulfills the criteria of the human origin. We have a name and we have classified with a correct taxonomy. It is manufactured in GMP conditions, and safety is clearly evaluated and documented on the target population. So when we perform the clinical trials, we perform safety and efficacy, of course, at the same time. And there are no toxins, no adverse events. We follow the adverse events in all the clinical trials that we perform, and we can be sure that over 30 years of clinical research has shown that this strain is perfectly safe. This is just an example of the type of safety studies, specifically safety studies that we are doing with this strain. Then what I can mention is that the clinical effects and the mode of action of this Limosilactobacillus reuteri DSM17938, you know that for probiotic research, the strain specificity is extremely important. Probiotics, I always say that probiotics are like human beings. We are all from the same species, but we don't have all the same characteristics, or we don't have all the same skills. So it's exactly the same for bacteria. And especially for probiotics, Limosilactobacillus reuteri, this is genus and species, but then it's extremely important to understand that one strain of reuteri is different than another strain of reuteri and has different capabilities. And in this case, with DSM17938, it has been studied on, I put here on 2 main areas: functional gastrointestinal disorders. It improves effect on gut motility. It reduces visceral pain. It has anti-inflammatory effects, and it has also been shown that it protects against infections. So when we talk about this trained immune system, is exactly shown by strengthening the microbiome composition and structure, tightening the intestinal mucosa, and inducing a protection on the intestinal permeability, and improving the immune response. So I'm not going to give you all the details because, as I mentioned, we have more than 200 clinical studies. I'm going to focus on the colic, condition, just to give you an example. But we have data and clinical data, published data on regurgitation, functional constipation, functional abdominal pain, as well as acute gastroenteritis, infection protection, and gastrointestinal antibiotic-associated side effects. So colic is a complex picture. It's a complex etiology where different factors are involved, from gut motility to hypersensitivity and visceral pain, connected with the immune system, connected, of course, with the dysbiosis and the microbiota structure and composition, connected as well with the gut permeability. But none of these factors are one more important than the other. They are all interconnected, and it creates somehow a complex condition for babies. We are talking about 20 to 30% of babies after birth and before 4 to 5 months of age. After this, this condition naturally disappears. But during the condition and during the problem of this infantile colic, of course, one important aspect is the baby's condition and the baby's suffering, but also is the whole family suffering as well from these problems in the baby. So it's a familiar problem that needs to be addressed. So what I show you here is 8 randomized placebo-controlled trials. These are at least a kind of a combination of all the clinical data that we have. I'm not going to go into all the details of these, but these has been all published. And what we can say here is that Limosilactobacillus reuteri DSM17938, which is called the protectis drops, are reducing the crying time already at day 21, and that was established in different independent studies, clinical studies, by independent researchers, by independent groups, independent hospitals, and independent PIs. And what is interesting is not only seeing that the primary endpoint has been matched, but also that the responders by day 21 are also all really well represented here. In some cases, we already have improvement at day 7, but that has not been shown in all the cases. I also brought you here a systematic review with a network meta-analysis, basically comparing the different treatments that we can find today in the pediatric practice to reduce the problems related to infantile colic. And as you could see very clearly here, is that the comparison versus the best treatment, Limosilactobacillus reuteri, is by far one of the best. Another important aspect, which is shown here, is this reduction of the less crying time per day, and after 1 week of treatment has already been shown with this strain. But this improvement is continuous until day 21, and it continues after day 28 as well. Another important data that we have on this strain is the fact that compared to, for instance, Simeticon, Limosilactobacillus reuteri is showing not only a reduction of the crying time, but also an increased responders versus non-responders compared to a pharmaceutical compound. So all this data, if we take only infantile colic, but we can also take other functional gastrointestinal disorders, have been used and have put this Limosilactobacillus reuteri into international guidelines, and I have here just a non-exhaustive list of these international guidelines recommending this strain for preventing and treating the infantile colic. So I mentioned at the beginning that this is a kind of a translational journey. So let's move from all this data that I was showing at the clinical level. How can we explain the effects of this co-evolved probiotic with us? And there are some lines of evidence that I'm going to bring here to you. Talking about gut motility disturbances, visceral hypersensitivity, differences in microbiota composition, and low-grade intestinal inflammation. So let's go to these multifactorial functional gastrointestinal disorders. One of the axes which is important in the infantile colic is the gut-brain axis, which is involved. And these microbial changes are, as you know, extremely important. They follow the neuronal processes through lifespan. So this is just a very interesting review by John Cryan and the team of Cork University, explaining how this neuronal development and neuronal proliferation and loss is related to the microbiota diversity through lifespan. But what I'm going to show you here is we do have some ex vivo and in vivo models showing, especially in mice, that we do have an effect on the visceral velocity, on the intestinal motility, which is induced by this Limosilactobacillus reuteri and not induced by other bacteria, like in this case Rhamnosus GB1. What we can see here is the impact in these models by the probiotic is showing a slower effect in the small intestine and a faster effect in the large intestine. And this is extremely important because it's exactly what we need to do in order to make this condition pass. I mentioned the gut-brain axis. Another aspect which is involved in this infantile colic is the TRPV1 pain receptor that we know, at least in a mice model, that Limosilactobacillus reuteri is inducing lower pain and is reducing the signaling of this TRPV1 receptor. And for the ones who are following the news, the Nobel Prize in medicine and physiology has been given to one of the discoveries of this TRPV1 receptor. So it's interesting to see that this probiotic has been also co-evolved to help us on that. And I can show you here the reduction of the response induced by DSM17938 on visceral pain in this model that I was mentioning. Another important feature, and this is also something which has been established in vitro and in vivo, is the fact that Limosilactobacillus reuteri is strengthening the mucosal barrier, which is a key actor for health. And I will come back to that later on, because this is important not only for the colic, infantile colic, but also in adults. That has been shown in newborn rats, but it is also extremely important in adults, and especially if we consider conditions like intestinal bowel syndrome. So I was mentioning also the fact that Limosilactobacillus reuteri can induce some specific reshaping of the intestinal microbiota, and especially the structure and composition. So what you can see here in these are data in vitro showing a list of the pathogens which are inhibited by reuterin. And some of these pathogens are extremely important in different cavities, in different mucosal cavities. For instance, we can have Clostridium difficile, Pseudomonas fluorescens, Escherichia coli. So these are important pathogenic bacteria in the gut. But I was mentioning also the oral cavity, Streptococcus mutans, Fusobacterium nucleatum, even Staph aureus. These are important pathogens for the oral cavity or for the skin. We also have inhibition of yeast and fungi and protozoa. I'm not going to give you all the details, but you can see that reuterin is an extremely powerful bactericide. So I was mentioning the specificity of strains, and I'm going to just illustrate this strain specificity with this chart. What you can see here is not all lactobacilli are the same, and I brought these two examples of two Limosilactobacillus reuteri, 17938 and 6475. You can see the differences on the immune signaling induced by one strain on the other. 17938 is inducing adenosine signaling and is inducing specific inhibition of Th1 and Th17 Tregs. And this is not the case for 6475, another of our strains, which this strain is much more active in the H2 histamine receptor, not the H1, the H2, which is directly signaling macrophages functioning and directly inducing an anti-inflammatory effect through the H2 histamine receptors. So as you could see here, when we speak about strain specificity, we are talking about data that we have from the in vitro, ex vivo, and from the preclinical models, which are feeding our clinical research. So I'm going to give you just one example of one of our more recent studies. So this is a rationale of a combination of two Limosilactobacillus reuteri strains. ATCC PTA 5289, as I mentioned, strain specificity. So we have to give the first name, the second name, and the ID. So PTA 5289 and Limosilactobacillus reuteri DSM17938. They were studied as adjuvants to reduce the duration and severity of clinical symptoms in children with pharyngitis or tonsillitis. So we have published recently a proof of concept of a randomized control trial. I mentioned that these randomized control trials that we are doing are placebo-controlled. So we tested the combination of these two strains, and this is a new product called Pharax, where what we wanted to know is if these probiotics could be an adjuvant to non-steroidal anti-inflammatory drugs. And what we showed here is that in 70 children, going from 6 months to 5 years, having pharyngitis and or tonsillitis, sore throat, etc., a daily dose of 4 × 10⁸ CFU of these probiotics, the combination of these two strains, compared to placebo drops, 5 drops per day, for 10 days. So what we show is that the supplementation with these two strains significantly reduce days with fever and severity of sore throat in children with pharyngitis or tonsillitis. So this is extremely important. I have some results here. I put some of the slides showing this. So what you could see here is the reduction of inflammation has been shown already after day 3 of the treatment of these probiotics. And then you're going to tell me, okay, there is a reduction anyway in the placebo at day 7. But if we do have an effect already at day 3, or as we could see here in the fever, we already have an effect at day 2 and day 3, these effects are extremely important because we are talking about 1, 2, 3 days faster effect, which could explain that the kids can go back to school, and then all the consequences of having a fast recovery are extremely important from the economical point of view as well. So you could see that behind that, there is this anti-inflammatory effect. There is the anti-inflammatory effect induced by 5289. There is also the reuterine inhibitory pathogenic effect by DSM17938. So the rationale of combining these two strains has been shown at the clinical effect that it was a good idea. And the mode of action is, as I mentioned already, antimicrobial substance, the reuterine, strengthening the mucus and the epithelial barrier. That has been shown preclinically, so the translational journey. We also have some data showing that there is an increased IgA in saliva. We have some preclinical data about that. So In other words, we can couple the clinical effects with some of the preclinical data. Conclusions: anti-inflammatory effects and faster recovery for the kids. So let's move now to our healthy aging portfolio. So we are talking here about preventing some of the age-related conditions and maintenance of general well-being, what we could also call like a stay healthy. So we have different offers here and different probiotics working at different levels. I'm not going to give you all the details of that. So we're going from gut health to oral health, periodontal disease, infection protection, strengthening immunity, and bone health. So I'm going to focus on the oral health because this is something I've been working on probiotics for more than 15 years, and I can tell you that these are extremely strong data. I rarely see such strong data today in the oral cavity with probiotics. So we in the oral health we have roughly 55 complete clinical trials. Over 2,000 individuals have been tested for this in these different clinical trials, and we right now have more than 40 clinical trials ongoing. So the oral microbiome is extremely important. It's the first part of the intestinal microbiome. We could consider that like that. The main characteristics is that we have here in the mouth the second most diverse and complex microbial community of the human body. This is after the gut, of course. This oral microbiome is exposed to the inhaled and ingested microbes, so it's interacting with the microbes that we are eating. Today, up to date, we have roughly more than 700 species that were identified, considering bacteria, fungi, viruses, archaea, and protozoa. And some of them are cultivable, others are not cultivable, and some of them have been already identified, but others need to be identified. But the main challenge of the oral cavity and of the oral microbiome is we do have biofilm formation, and we do have a diverse microbiota in the palate, in the tongue, or in the dental plaque, or in the saliva. So the sampling of this oral microbiota is a challenge per se. I mentioned these two strains already. I'm just going to give you some of the preclinical data here. On the left, you could see the origin is the breast milk. This is Limosilactobacillus L.reuteri DSM17938, and this is the effect of the reuterin, for instance, against pathogenic inhibition. In this case, is Streptococcus mutans, which is a pathogenic bacteria in the oral cavity and involved in some of the caries, for instance, development. On the right side, you have this PTA 5289, which is a strain coming from human saliva, so adapted to the oral cavity, and showing a strong anti-inflammatory effect in the reduction of TNF-alpha, especially in some of the macrophages secreting TNF-alpha. So we show that 17938 is reducing some of these pathogenic bacteria which are important in the oral cavity, Porphyromonas gingivalis, Prevotella intermedia, or Agrigibacter as well. And I'm going to give you a little bit more information about this clinical trial that was mentioned already. This is a fascinating clinical trial, and it's one of the honestly, one of the strongest effects that I ever seen on probiotics, because here is the perfect cohort. We are talking about sailors, 72 crew members for 42 days. They were in a boat and they were sailing. And then we had two groups, 36 in placebo and 36 receiving the combination of these two strains. in the context of very poor hygiene conditions, very poor dental hygiene conditions. So on board, we had a dentist taking care of odontologist analysis and taking care of the measurements. And what we could see is that, and this is on the graph that you see here, the baselines were very similar in the L.reuteri group compared to the placebo group. But then at day 14 and day 42, we could see a reduction, significant reduction of the inflammatory parameters. In this case, it's bleeding on probes. This is a very clear endpoint and parameter for gingivitis. We show that not only in bleeding on probes, we show that also in gums inflammation, and we show that also with some RT-PCR measurements, showing that we could have, by the treatment of the probiotics, already at day 14, a reduction of this inflammation or inflammatory processes. But that was maintained after 42 days as well. And as you could see here, it was not the case for the placebo group. So we had the same type of reduction in pain, in inflammation, and in bleeding on gums. So these strains are showing clearly that the combination of an anti-inflammatory effect together with a L.reuteri effect is reducing inflammation in gums and reducing gingivitis. So that has been published last year in the Journal of Periodontology, and of course we are continuing in this work and understanding now what's going on in terms of the microbiome composition, but also in terms of inflammatory processes. So I'm going to bring you also some data that has been published 6 years ago on how these probiotics are impacting the oral microbiota. This is a study that has been performed in Umeå in Sweden. And it's interesting to see that after 12 weeks of supplementation with these two strains of Limosilactobacillus reuteri, in a randomized controlled trial, what we could see is that, first of all, the structure of the oral cavity has not been fundamentally changed. We have to consider that these are phyla distribution, and the phyla distribution that has been performed in 454 pyrosequencing. This is a technique which is not used anymore, so it's a quite old study in that regard. But what is interesting here is to see that even if we don't have a strong impact on the structure, and this is saliva microbiota, basically, what we could see, nevertheless, is the fact that in the treatment group that you can see here, we could see and we saw an increase of Streptococcus oralis cluster, Clostridialis, Limosilactobacillus reuteri. So we could see that some of the commensals, which have an ecological positive effect, have been increased in the treatment group compared to the placebo group, where most of the pathobionts or pathogenic bacteria like Fusobacterium nucleatum, Prevotella maculosa, Streptococcus mutans were increased. So even if the whole structure of the oral microbiome has not been impacted, which is something that is also has been also observed in the gut for probiotics, we could see that some members of the microbiota are changed, and this is showing us that the ecological impact of these strains, of these probiotic strains, is significant, is really important, and is going to the right direction. So what we are now interested in is in trying to understand how are the links between this oral mucosa to the systemic effects. And I'm not going to give you a lot of details on that and information, but we are following this data at the clinical level. We are following that in two directions. At the preclinical level, so we're trying to understand and identify new probiotics that are able to modify the oral microbiome, but also we are starting new clinical trials in order to understand if there is a connection between, for instance, periodontitis and type 2 diabetes, or periodontitis or other diseases. Well, last part of my presentation, I think I have only 3 slides more. I like to mention also the fact that in BioGaia we are extremely interested in working on Limosilactobacillus reuteri strains, but we're also working on the next generation probiotics. So we have a center of excellence in Eslöv, where we have also a BioGaia production, and in this center of excellence, together with the BioGaia production, we combine all this research that I was mentioning with the development of product. So I don't have the time to explain you all what we're doing here, but this is extremely important for you to understand that we are combining the need of developing a product together with the science. And when I mentioned the microbiome partner, we also work with, and we have Tanweer here with us, with the development of the next generation probiotics, which, as you know, are extremely important as the future for the probiotic field, because we are talking about novel anaerobic strains derived from the human gut, but not previously used as probiotics. And this is extremely interesting because these next generation probiotics are bringing us the concept that we are maybe bringing back to diseased people, or in people suffering from some conditions, bacteria which are able to, for instance, produce butyrate or produce other short-chain fatty acids, and bringing back metabolites which are important to correct some of the diseases. So we are working as well with these approaches in BioGaia. And I think this is also interesting for you to know that, because it's coming back to my first slide about the coevolution and about the Holobiont. So we are continuing this journey by understanding how the bacteria which are already there present, that in some people could miss, how we can reintroduce them in order to improve people's life, because this is really what we want to do with probiotics. So with this, I'm going to say thank you for your attention, and I'm happy to take questions.
Thank you very much, Dr. Gianfranco. So we have Dr. Tahir Mahmood in our audience and Dr. Tanweer Khan, who are in the area, and maybe they have questions for you. But it was really, really interesting and very detailed and informative presentation that you gave us. You took us through many research studies, I believe.
I would like to add up, I'm not a doctor. You can use the term scientist, or maybe a student. We are trying to learn every day. I have to say thank you to Estella, first of all. She's not present. Kindly say thank you to her, and also to the Peter, our ambassador, Excellency. I'll spend the time. And a special thanks also to Franco for wonderful research, which has been on the table now. And I personally believe you guys are the pioneers in this area. I've been studying a lot of direction of the research. A lot of research is very relaxed. You know, when they are going on trials, they want to success this. But you guys regulated your research on a strict manners of safety. That is most important. Like, you don't give concession to yourself to be happy. You understand? You want a success, you regulated the research by yourself, a self-check system. And that's wonderful. The second thing which I'm thinking now, especially I had the interaction with Dr. Tanweer regarding some type of herbal formulation against COVID based on pH level of the body to regulate it. And that's the way I know Dr. Tanweer, and I have a huge confidence. You guys are wonderful combination, and this is going to show results in very near future, what you guys are doing. And the bacteria, you know how many stains we have gone through in our research. Maybe there is plenty to explore more as we move forward, and how we can evolve further for a human use all these stains, and then creating further research in multi-directional regulation of the body, because I still believe that it's intensive work what doctors are doing day and night. Research scientists are doing as well, but we are not. We don't claim like we are done. Every day the world is dynamic, the environment is changing, and in the dynamic changes of the environment, it is very important, like researchers like you who are very dynamic and looking forward what we can fill the gaps, because gaps gonna emerge anyway. New virus, new attacks on the body, new microbic world, it's going to generate anyway. Since the creation of this universe, we see evolution. Things are producing, reproducing, recycling, getting new features, new characteristics. Even human body itself is changing. We are not the same person as I remember our grandparents were as strong. We have some other strengths, but also we got some weaknesses. So all these are the gaps. I think your company is doing very well, and we support. Your company, not we are not commercial organization. We are more like non-government volunteer organization, but where we see the importance of the things. So surely, Franco, we are at your back, and especially Dr. Tanweer as well, and the BioGaia company. You guys continue this work, and what we can do for you guys, as the ambassador has promised as well. He was very, very happy to see you guys, and also to create a collaboration between country to country. Pakistan is a country of 220 million people, and it's just a matter of how the good work, the good product is going to be introduced. The company must do further mapping. If it's a price, if it's something else, what are the variables which are not driving this product? Of course, your product is there with frozen, wonderful. But I think we must get the use of it. It should be off source. What should be the best manners? These are our future challenges as well on commercialization. So far, on your expertise, on the research, we are fully satisfied. Thank you very much for a wonderful time today.
Thank you very much.
So I would like to say a few words. First of all, I would like to thank Isabella for arranging and taking her time for such a wonderful session. And many thanks for Gianfranco, because I know he's very busy and traveling. But I think this is not just a presentation. This is a milestone, and this is available on social media. So as a student and those who are really interested in probiotics, and after this pandemic, the interest in probiotics is increased dramatically. So I think for the newcomers and for the students, this is basically a something they can use this session as to understand from basics to the advances. And thanks.
I fully agree, and that was a pleasure and an honor for me to participate in this. And I think this is just the beginning. And of course, if it can help students, but also if they have questions, they can reach me. It's always a pleasure for me discuss science and exchange. And as we mentioned also at the beginning, we are all the time looking for partners to develop clinical science and clinical research, and also as I mentioned at the presentation, we want to improve people's life. So that means in Pakistan you might have specific diseases or specific concerns that we can try to figure out with the specific probiotics. We can also interact in different ways in terms of having doctors from Pakistan giving talks in our activities. We can also share with you our new ideas for the future. We can share with you the concepts that we are developing for the future, and I have your opinions as well. So I think this is a construction. It's really interesting when the science is put on the top.
And the most wonderful thing is a service to humanity. It's based on care and values, where a child is crying for a whole month, and now we are reducing, a child should be a smiling kid. So all these are, we have to see the importance of these issues. It's not just a cure. It's a matter of giving pleasure and relief to the humanity. And absolutely, if we continue this journey and continue exploring this research, and even as it was mentioned, to recruit PhD ones, definitely we have a lot of wonderful people like Dr. Tanweer. I mean, unbelievable brains, and I think we should use those brains before they are rotten. So this is very, very important for all of us to get together, get in the social media, bring our exclusive innovative research from Sweden and from the Europe toward the east side. These are the collaborations of East and West, where countries are sitting on different issues. We are the one who are getting them together.
Wonderful. So many thanks again, Dr. Gianfranco. I'm sure students and professors, they will benefit from your detailed research presentation. And as Dr. Tanweer said earlier, it's not just a presentation, it is a milestone. And we hope that this will open some new doors of collaboration with BioGaia and people from Pakistan. So thanks, Dr. Tanweer. Thanks, Mr. Tahir Mahmood. And again, many thanks, Dr. Gianfranco. We can close the session for today.
Okay.
Take care. Bye.
Thank you very much. Bye-bye.
Bye.
Bye-bye.